my name is Caitlin. I'm from grassfedgirl.com, and today we're so excited. We have Dr. Kevin Stock with us. He is a dentist from Missouri, and he is going to tell us all about food and teeth and how the carnivore diet can help your teeth. So stay tuned all the way to the end. We're going to talk so much about dental health today, and it's going to be great. Welcome, Dr. Stock.
Hi, thanks for having me on. Excited to talk about teeth and diet, my favorite my favorite discussion topics.
Yes. So tell us, a lot of dentists don't really believe that teeth are food, and food affects your teeth or your health at all. So how did you kind of break away from that idea that it was just all about fluoride or brushing?
Well, what's interesting is like dentists, like I do pediatric dentistry part-time, and like we're literally required to do nutritional counseling like with children. So like we as dentists should be doing nutritional counseling with our patients. I would say the major disconnect is what that nutritional counseling should be, and I think probably most dentists don't do it. And I think there's a variety of reasons for that. One that they don't know what to say. Two is they probably don't think patients will do it even if they did know what to say. So I think there's a big opportunity for dentists to make incredible impact on people's lives through nutritional counseling, not only for their mouth but also for their overall health as well. Because I think it's shouldn't be like a surprising thought that a diet that is bad for your mouth that's causing your teeth to decay and you'd have periodontal disease where the bone's rotting where the bone is rotting away, making teeth loose. Um, like a diet that does that, because it is diet induced mostly, like is probably bad for your systemic health as well. But if we can find a diet that's good for your oral health, I mean, I think it's a natural kind of segue to creating, overall systemic health.
I think most people would assume dentists get a lot of nutritional training in their schooling. Is that true or no?
It's not true. It is true that we get training about, I'll say, the etiology of decay, like what causes dental cavities and periodontal disease. And it's pretty clear, like we know what causes cavities to form. It's fermentable carbohydrates, all fermentable carbohydrates, starches, sugars, and bacteria in your mouth ferment these carbohydrates into acids, and these acids hold in your teeth, causing cavities and lead to things like needing root canals and crowns and the whole smorgasbord of dental treatment. So we do know that. So we know the culprit. But it's just interesting. I like to tell this story because I take all the CE, the continuing education courses on dental health and nutrition, because I'm curious what are they telling us to tell patients? And the last few I've taken are just so disappointing, meaning like we go through this is what causes cavities. And then in the second half of the program, they'll be like, okay, this is what we recommend you tell your patients to eat. And it's a carbohydrate based diet. And by that, I mean 60+% of the diet is fermentable carbohydrates. Literally, what we know is causing the cavities is the diet that we're recommending patients, the healthy eating plate, if you will, which is,
So
basically
just
just the
like
government
the
sponsored.
same government ideas.
Exactly. Yep.
But I guess these organizations are linked with the government in some way, so
Yeah.
they would be radical if they change their ideas to be different, right?
Yeah, I think it's just like they want to abdicate responsibility, where I think like as a dentist, I think half of our responsibility should at least be preventative. Um, but I think most dentists, their 98% of their life is not dealing with preventative. It's like, hey, we have fires to put out, we have cavities and periodontal disease and teeth to take out. So we're spending all our time doing this stuff versus, yeah, so we don't spend much of the time on the preventative, which in my opinion would be talking about diet.
And maybe they feel similar to physicians that
Hmm.
it's kind of a waste of time because nobody's going to do it. Like,
It's just, I think
or
so.
it's not PC to tell people,
What to eat.
what they're eating is hurting them or making them sick or fat or whatever.
I think that's true. I think there is a degree of like when you talk about nutrition, it's almost like talking about politics or religion where people take it very personally of like when we're just trying to give like objective point of views. And yeah, people can take it personally. So I think a lot of times dentists, physicians, whoever it might be that's in the healthcare space, that's indirectly impacted by nutrition because nutrition impacts every aspect of healthcare. Some healthcare professions are more aptly trained and in a position to deal with, I would say, nutritional counseling than others. But yeah, it touches all aspects of healthcare. So,
Well, and
uh,
also limited time. I mean,
yep.
I think doctors are affected by that. If they're trying to see 20 people in a day or something, then they don't want to, they just want to say the most amount of necessary things and leave out the rest.
Yeah, I mean, spending 20 minutes doing nutritional counseling with a patient is just lost revenue. Like, bottom line, if they could be doing treatment and making money or somewhere, doing something else, whereas like nutritional counseling, most dentists aren't servicing that, like getting paid for anything like that. So,
Yeah.
you're right.
And I mean, cavities are money, right?
That's true as well. That's true as well. So it's like if you solve it would cost you money to do the preventative, like you're losing time. And then if it actually works, then you're not getting anything on the back end. So, I mean, incentives are poorly aligned. And that's not just dentistry, it's just kind of healthcare. Like healthcare professionals make money with people being sick. If everyone was healthy, everything would only be preventative, which would be a fantastic world to live in. But I mean, the number of healthcare providers we would need would be much much fewer doctors would be needed if everyone was
Yeah.
just eating appropriately and just coming in for routine checkups.
So tell us, your story. What first opened your eyes to this whole thing?
So it goes back a long time, and I got obsessed with nutrition way back in junior high. I was an overweight kid, and so my obsession with nutrition stemmed out of trying to figure out how to lose the fat, which I was very insecure about. And it later turned into like in high school and college, like, okay, how do I build muscle and like build the body? Like, so it was very much fitness focused. And that started way back in junior high. I'm doing weird diets. And because it was really my only interest through high school, as far as academics, I went and did a degree. I got my degree in chemistry and a minor in biology in college because mainly so I could focus these sciences through, how to use this to build muscle and lose fat. And I was thinking I'd go into one of the healthcare professions. I was thinking maybe medical school, maybe dental school. I was talked out of medical school, so, so I ended up going to dental school. Um, and by the time I was in dental school, I was doing like physique competitions. I was doing some like online coaching programs on the side. And so I would say the first half of my journey was very much fitness focused. And then as I have gotten older, it turned into a health focus where I wasn't like I was happy with like the body, but I wasn't happy with how I was feeling. My energy was low. I needed to drink caffeine all day long. There's all these various things. I'm like, all right, something isn't right. And that's what led me. I did a ketogenic diet for a while, which I'll say kind of failed. And but it was the gateway to going basically eating only meat starting like in 2017. So it's been a lot of years now. But that was the journey to carnivore. It was through initially fitness, but then kind of trying to find the other half of the equation, so health and fitness. And sometimes those are mentioned in one breath, but oftentimes, especially like fitness type influencers, they're only talking about the fitness. Like you're talking about macros and things like that, which can definitely improve body composition, but just because you're fit does not necessarily mean you're healthy. And there's lots of personal examples in my family. My dad I use commonly because he's like my height, 5'11", 160 pounds, has never been overweight in his life. Active, lifts weights, he's out in the sun golfing. So he's doing like all the things you think is healthy, but he's had like every health issue you can imagine. Like everything from stomach problems to gallbladder out, kidney stones, poor CAC score recently. So it's like, hey, just because you have the
Oh,
fitness, you don't necessarily have the health.
the heart thing.
Yep.
Oh yeah. I mean, everyone in my family is obese, um, but so they don't look healthy. But what I was gonna say is, oh, I was a personal trainer for a long, long time, for 7 years, and my most unhealthy, I was the fittest looking, and
Hmm.
then my thyroid exploded. And so, because of all the fit, diet, the low fat diet and
Yep.
the, drinking artificial
Everything.
sodas, and I mean like sugar-free sodas, but just pushing, 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 and very limited nutrition. So pushing my body with extremely hard exercise, but not eating enough fat and, protein, I'm sure. Um, so yeah, I was definitely in that, many, many years working in the gym with all the trainers and,
Hmm.
really exposed to the unhealthy lifestyle. They all looked good, but, later on, I'm sure it fell apart.
Hmm.
The protein powder,
Yep.
fat-free protein powder, Um, so yeah, similar to your experience in that way. So, so then you did the carnivore diet, and did that kind of shape some of your opinions about what we should eat for dental health?
It's interesting. So a lot of this was happening concurrently, where basically the thesis that evolved over this is that our mouth really can tell us a lot about what we should be eating. And the diet that's causing your teeth to rot is likely not a healthy diet. So a high carb diet. I had been low carb long before this. And I would do things like carb cycling, but I haven't eaten like a high carb based diet in a long, long time. So I was low carb, I would say before going carnivore for a long time. Uh, but there was other things that, yes, the thesis kind of turned into like the mouth being able to tell us a lot about what we can eat. And a lot of my research over the last 5 to 10 years has been kind of focused on this thesis of like, hey, if your diet is causing your teeth to rot, that's probably not a good diet. Things like malocclusion and why do we have crooked teeth and why don't our wisdom teeth fit in? This often think people just think this is a genetic thing, but a genetic explanation really doesn't make sense in the scales of I'll say evolutionary biology. That, like our genes don't change that much, in thousands of years, nonetheless, just a couple hundred years, just a few generations. So yes, the diet. It's hard to say which one informed it most. Like, hey, I'm trying to figure out diet for my overall health, but also from like the oral dental perspective. We know lots of sugar, lots of carbs are bad. Um, I would say what's a healthy fat? Like something that really had to, I had to turn 180 degrees on from when I was young to now, where it's like, hey, the definition of healthy fat to me is, I think, one of the most problematic things people have. Like, we can go deeper into what is healthy fat, not healthy fat, et cetera. Um, but yes, I'm not sure if that's answered the question, but the mouth and the body and what that tells us about what we should be eating, really, for me, kind of put all the puzzle pieces together.
So did you have cavities and stuff when
As a
you were
kid,
younger, and then now they're better?
yeah, I had all the things. I had cavities when I was a kid. I had malocclusion. I had the braces and the headgear. I had to get my wisdom teeth taken out when I was just 13 years old. So I had like all the common things that I talk about now.
Malocclusion is crooked teeth.
Crook, yeah,
Okay.
simply crooked teeth, but it's also the way the jaws fit together. So sometimes, you'll see people with a bottom jaw that's very far recessed, like backwards. Mine is more recessed than I think it should be. So it's how the jaws fit together and how the teeth fit together, more specifically. But yeah, malocclusion, crooked teeth, impacted teeth, things like that.
So, I'm sure you studied Weston A. Price. Do you think his ideas are in line with what you agree with, or what you've?
I would say mostly. And I mean, quickly, for those that aren't familiar with Weston A. Price, he was a dentist 80 years ago, 100 years ago, where he was traveling the world. He went to 5 different continents at a very unique time in history where the airplanes were actually like a new invention. So he was able to travel. Photography was also like a new invention. So he was able to take all these pictures. And the modern diet was just encroaching on various parts of the world. So he had the combination of these things led for very interesting studies that he did in the 1930s, where he went to these places around the world and was like, hey, these people are eating an indigenous diet before the modern foods entered. And he was looking to see, do they have cavities? Do they have malocclusion? He's taking all these pictures. He's also evaluating their physical health. And in a town just next door, for example, they would have recently introduced modern foods, which is mostly sugars and flours and jams and things like that at this time. And he would notice, oh, they got lots of cavities and they have malocclusion now, and they're also physically they're more prone to disease and things like that. So it was a comparative kind of analysis of indigenous diets versus modern diet, all around the world at this time. And basically, what he found was like those that were eating their indigenous diet were much less prone to cavities, malocclusion, and any physical oral degeneration. And those that introduced the modern foods, one, the first generation would get cavities very quickly. The
Very,
second
like just
generation would
one
start getting
generation, right?
well, yeah, the cavities would form in that first generation. Second generation, they were getting malocclusion and having other physical degeneration and higher susceptibility to disease. So that was his general kind of observations. And so I agree with that. One thing I like to say that Dr. Price often missed is basically his hypothesis was we had a caloric limit, like 2 to 3,000 calories a day. And because people eating the modern diets were filling that calorie limit up with sugars and flours that didn't provide very much nutrition. They were lacking the nutrition to be healthy. And that was like his general thesis. And because they lacked the nutrition, they were getting cavities and malocclusion and physical and oral degeneration. I agree with that. Like there was like a malnutrition aspect to these problems. However, as we know today, like we don't have a 3,000 calorie limit. We know a lot of people are eating much
Oh,
higher than that. And in his seminal book, it's called Physical and Nutrition and Physical and Oral Degeneration. I may have just messed that up, but anyways,
it's close to that.
yeah, it's about oral and physical degeneration and nutrition and oral and physical I don't think he talks about it. It's just nutrition and physical degeneration,
Yeah.
whatever. It's his book. He he never mentions like, overweight or obesity. So this is the 1930s, like, and he's traveling around the world,
He didn't know
and
it happened. He didn't know it existed.
this book is 500 plus pages, and he's talking all about all the oral and physical degeneration of all these people he's seeing. He never mentions overweight or obesity, and the reason being is like obesity was not much of a problem at that time, well, like it is today, where it's by the end of this decade, it's going to be 50% of the U.S. population, but also the fats that we were talking about earlier, the healthy fats, the vegetable oils, were a very modern food at this time, meaning like they didn't make up as much as the displacing foods of modern commerce, which is what he would call them. So I think that is one of the new problems that we face today that, Dr. Price didn't see back then. But overall, I would say I agree that yes, malnutrition is an aspect of oral and physical degeneration. We don't have like this calorie limit that he hypothesized. We can go above that, and I think vegetable oils play a big role in that. Um, and yeah, so overall,
One,
I think a great book, interesting book to read.
one thing he was really focused on was the fat soluble vitamins. And, if you, like you were talking about the fat, if you replace those with, or you're not getting those, and then you're eating vegetable oils, that's like a double whammy because, and then, the prevalence of now like being cool and being vegan and everything. So you're getting even less fat soluble vitamins. Talk about the fat soluble vitamins.
Yes, so fat soluble vitamins. Uh, Dr. Price called it Activator X back then because he didn't even know what it was. And so in many ways he was kind of the was the discoverer of vitamin K, specifically vitamin K2, which is the kind in animal form, like the animal form, vitamin K1 is the plant version that we can convert to K2 in minuscule amounts, but really what we need is vitamin K2, the kind of like the bioavailable active form for us to use. And so he's kind of discovered that, but he called it Activator X. He wasn't sure what it was at this time. And vitamin K and vitamin D, these fat soluble vitamins, play a really important role in calcium metabolism. And so calcium, for example, like if you think about it, you want calcium going to your teeth and bones, to create strong teeth and bones. But you don't want calcium going to your arteries and calcifying your arteries. So is calcium good or is it bad? Well, it all depends on how your body is placing calcium. And these fat soluble vitamins, particularly vitamin K, plays a very important role in the how the body uses calcium and moves it to the hard tissue where we want it and away from soft tissue where we don't want it. And so, yes, Dr. Price was kind of the founder, if you will, or inventor, or discoverer of vitamin K. And he focused a lot on K and D and their importance in prevention of decay. And yeah, he's right. They do play a very important role in preventing decay. I am on board with that. And vitamin D, interestingly, even into almost like the mid 20th century, so 1940s era. It was like the one like common known thing to help prevent cavities. Like, hey, if you're deficient in vitamin D, you'll be more prone to cavities. So, hey, supplemental vitamin D is actually kind of shown to help prevent cavities. So, yes, these fat soluble vitamins play a very important role in oral health. I would argue physical health as well. Uh, so yeah, and Dr. Price talks all about those.
Um, I think it's, and what are the best foods for those?
Well, like I said, so there is vitamin K and vitamin D in both, I'll call animal forms and plant forms. And so the animal forms would be vitamin D3 and vitamin K2, and the plant forms would be vitamin D2 and K1. And both of these we can convert to the basically the operating system that we need, right? So we got to convert the plant operating system to the human operating system. But various studies show that we do this very inefficiently. And so if you're trying to rely on just plant versions to provide all that you need, often you're going to find yourself being deficient in these vitamins. So animal foods and they're fat soluble, so animal fats. So unsurprisingly, things like eggs and beef and organs and dairy, especially these that are rate animals that are raised properly on feed that they should be eating. For example, like a cow eats grass, there's K1 in the grass, but the cow will convert the K1 to K2. And so when you eat the beef, you're eating the K2 version that we need. You can try and eat grass and get nutrition out of that, but you'll realize it's hard to extract nutrition out of grass because we are not designed to, eat grass like cows. We're not ruminants. So we're designed to eat a certain diet. And a lot of my work is like, hey, your mouth is designed to eat a certain diet, and like that diet is congruent with, your body as well. And so things like this, like nutrient bioavailability, tell us a lot of like, hey, you can't get that out of grass, but you can get that out of, eating a cow. So it gives us clues on what we should be eating, I'd say.
And steak tastes a lot better than grass.
Yeah, I would agree.
And I always thought it was funny when people say, well, do you have like an inclination or an instinct to go and stick your head in the grass? I was like, no, like it just doesn't happen. And
No,
yeah, Weston A. Price was really focused on the grass-fed butter, wasn't he?
he was. And because he was big on the fat soluble vitamins, A, D, and K2. And so the grass-fed butter basically is the concentration of these fat soluble vitamins, in the dairy that is then concentrated into the butter.
And you
So
can see it's more yellow than if you put it up next to just regular butter. It's like
yeah,
almost
looks,
golden.
yeah, definitely looks different.
My child is 3 and he will just eat slices of butter off a plate, or if I put it on top of something, he eats that first,
Hmm.
before it melts, he'll just eat it. And it's really cute. What age should kids start going to the dentist
What should they or when do they?
or both?
Because I think, I mean, I've done pediatric dentistry since I graduated, so it's been over a decade now. Um, and there's a big thing about going even before a kid's ready or needs it necessarily. Oh, they get comfortable with the dentist and the environments where a lot of times, like a practice that I worked at, it was down in St. Louis City, basically just a Medicaid clinic. And we just saw so much lower socioeconomic. And the first time a kid sees a dentist, I look at their mouth, I'm like, we got to take 5 teeth out. That is a really bad first experience for the kid. They're never going to want to go to the dentist again. And they're just basically set up for a lifelong problems. The opposite is the experience that you want, is where they don't have any problems. They're going in like they barely have any teeth coming in. You're like, oh, you look good, and they're comfortable. And education can happen during these formative years where they're comfortable with the dentist, and that can set them up for success. So as far as like when I think people should start going to the dentist is um, as early as, I mean, even it's like if you had an infant and you're going to the dentist, you bring, your 6-month-old with you. Now, they're not going to be taken in too much at 6 months, years old, but what I'm basically saying is like just take them with you initially, and then it can
Just
turn
like
into their short initial appointments, etc. And most pediatric dentists or general dentists will be on board with that, just making so uncomfortable, a child comfortable with the environment. When do they need to start seeing a dentist is when their primary teeth really all start erupting. And so by the time someone is 3, 4 years old, I mean, they should be, I would recommend regular visits. I see kids generally starting in pre-K to kindergarten. So that's that 4 or 5 years old.
Okay. I just took mine. He was like 3.5.
Hmm.
But he doesn't really it's really hard to get him to brush.
Hmm.
And I think he thinks it's like ticklish or something. So but he let him look, but he wouldn't let him clean. He would let
Yeah.
him look in his mouth. Of course, he had to be bribed and whatever. I don't
Right.
know. But she said she didn't see anything, but she said just bring him back in a few months, like, and maybe he'll be more comfortable.
That's exactly it.
This was a place that I have a holistic nurse practitioner that's our doctor, and she recommended this place. So they seem pretty good. I mean, it was only a kid's place. So,
Hmm.
um, but what if you have a kid like or grinding teeth? Like, what does that mean?
It's a bad sign. I mean, it's not normal, is what I should say. Snoring, grinding, things like that, the parafunctional behavior. Uh, a lot of times people just think, oh, it's normal. It's not. Kids shouldn't be snoring. And it's often the first thing I think about is the airway. And so, just for a little bit of background information, after I graduated dental school, I've done pediatric dentistry very part time, but I started my own private practice just doing something called dental sleep medicine, which is where I was treating sleep apnea, adult sleep apnea, but with oral devices that hold the jaw in a particular position to keep the airway open so that they can breathe all night. Because what sleep apnea is the airway basically collapsing and you're more or less suffocating throughout the night. And so the airway will shut down, the body will pump a bunch of stress hormones to get you to gasp and basically open up the airway.
Oh,
Often this is just subconsciously. So you're not consciously waking up, but the body wakes itself up and then the airway shuts down, the body wakes it. So it goes on and on and on. Well, this is um like I'll say more mild forms of this, things like upper airway resistance syndrome, um, and or kind of like snoring is a sign that the airway is closing down. And so one way the body kind of wakes itself up is pumping these stress hormones and it can result in like grinding teeth. So it's a behavior to kind of wake the body up to open up the airway to facilitate breathing.
hmm.
So that's the first thing I think about. I would look in a kid's throat to see like, do they have big tonsils, adenoids? That's often an issue. Um, and in adults, there's various things. A lot of times it's related to, overweightness, but also just underdeveloped jaws is one of the foundational issues. Is our jaw the same reason why all our teeth aren't fitting in and we get malocclusion, we get like our jaws aren't growing big enough. And so basically the airway is smaller than it needs to be. And if someone has excess weight as well, that will be deposited in the tongue and the surrounding tissue. So it just everything's getting too small, and that's what leads to apnea. So I would definitely that would be my first thing I would look for in a kid that's snoring and grinding, especially if they have any kind of daytime behavior that's like related to needing ADHD medication, like they seem hyperactive. A lot of times that's a sleep problem. So that's the first place I'd look.
And then with a kid that's young, where do you take them?
Yeah, I mean, a dentist, a pediatric dentist should be looking for that, but if they're not, you talk with their primary care physician, be like, they've been snoring, they're hyperactive, they can't focus at school, they're getting in trouble, poor behavior. They would likely then send them to an ENT who will look in the throat and see, hey, do you have big tonsils or adenoids? Usually would be a first step to be like, consider taking those out. Like, we don't like to take those out, but like if you're not breathing because they're so big, that's that's one of the places they'll start. And just as an aside, one of the reasons they do get so big is mouth breathing. So that's what you see with a lot of children. Like we should be breathing through our nose, mouth should be shut all the time, except for basically when you're talking. So yeah, the proper breathing is really important and related to this whole sleep apnea issue.
Yeah, mine, he grinds, but a little bit, not a lot, but a little bit. I'm always like, what is that? But they said it's kind of like too young to really do that much right now, but I, I'm, I think there's more I could do. So what are some of the red flags? Like when you go to the dentist and you're kind of like, um, you go to the dentist and it'll tell you that this dentist is not really in line with like my values and what I'm looking for.
It's a good one. It's a hard question, and it depends on someone's individual's values and what they're looking for.
But like if
And
you're carnivore and like you're trying to get healthier and stuff.
I can give you a few examples. For example, if I'm going to go to the dentist, it's not going to matter much to me because I'm not going to need work. They're going to ask if I want fluoride on my teeth, and I'll just say no, and everything's going to be fine. Like they'll look, check out the teeth, do a cleaning, send me on my way. So it doesn't really matter to me. And someone that's looking after like eating a proper diet and doing basic things to maintain good oral health. Someone that is not doing those things, well, that would be the first place to start is maybe we need to do some of those things and get counseling on how to do some of those things. Um, and then you can go into the questions like, I mean, a lot of people aren't doing amalgam fillings anymore, but if someone's going to do, that's the silver mercury fillings, people call them different things. A lot we've moved to composite fillings, but like those also have problems. So there's different treatment modalities where people have concerns, root canals, et cetera, et cetera. We could talk about those. Um, but I would say the red flags would be if they just aren't willing to negotiate, or not negotiate, but discuss like diet, preventative, if they are just if not respectful to someone's desires to not want fluoride, um, things like that. Well, like I feel like if they're not giving you a say in or addressing your actual concerns, then there's holistic and biologic dentists who will absolutely listen to those concerns. Not only listen to them, they're gonna sometimes swing too far in the other direction, where you're gonna end up with a $50,000 treatment plan because they're gonna want to take out every filling, every XYZ. They're gonna want to do everything in ceramic, maybe just overdo things a little bit. And I should say overdo cautiously, but sometimes I've seen both sides of the coin here.
Yeah, I've had both because I've been to a biological dentist and everything was like if just a cleaning was like $250 and they don't take many insurance or
Hmm.
if insurance at all. And I was kind of like you, like, okay, well, maybe I just take my chances with the other dentist and just see, if I'm good, if I'm healthy, if they don't find anything, then I'll use this biological dentist as like a second opinion kind of thing.
Yep.
But then I went to another dentist and I hadn't been going to the biological dentist for like 5 years. And then I'll go to the regular dentist and they said all these old fillings were bad.
Mm.
And also I have new ones. And it's like, but I think maybe because I was pregnant,
Yeah.
that maybe I had some nutrient deficiencies after, or like the baby draws all your reserves, right? So maybe I got a cavity or two from that. But also maybe my dentist was too aggressive with fixing old things.
I
The new,
see it all the time. Yeah.
yeah. So I don't know which is because I felt like the other dentist was almost like too uh lax, like you're fine, you're fine, you're fine. But then this new one was like, we're gonna drill 10 things. And I was like, oh, I don't know who to believe.
Yep. That's really hard. And that's where second opinions are nice to have and really trust with the dentist that you have. Where I lean towards conservative, being like, hey, this looks like it could be risky. We'll keep an eye on it. But if you're eating the proper diet, like you've been talking about, and doing the various oral hygiene stuff to help prevent, like, you're probably good. So I lean towards the conservative side, but more on the aggressive side, I should say, is so I do this pediatric dentistry, and they send me through rural America or rural Missouri, and it's lower socioeconomic, and these kids eat very poor diets and often little to no oral hygiene practice. So when we see these kids, we are more aggressive, meaning they have 10 small fillings or 10 small cavities where, and sometimes you're like, hey, if I could work with this patient and get them to change their diet and fix their oral hygiene, we could like just watch some of these and be okay and very conservative. But if you're not going to see that kid again, and you're like, we got to do this now, or it's going to turn into
But
who knows what. So,
they'll lose all
th
their teeth or
yeah,
something.
so dentists have to weigh various things in their head, meaning like likelihood of change and prior history and things like that. But I mean, with you and eating a low to no carb diet, your risk of cavities, especially if you're a nasal breather and like you drop your risk to the lowest percentile possible. So so I would think you'd be pretty well off.
I mean, that's what I would think. But it's kind of like figuring out like it's hard because sometimes your insurance covers one dentist, but you want to go to this other dentist and you're like, but you have to be loaded to go to the
Mhm.
biological dentist and it's hard. My mom goes to the biological dentist because Medicare covers it.
Oh, interesting.
So I'm like, well, that's lucky, but I don't have Medicare, so
Yep.
um, so maybe I'll just wait till I'm 65 then. No, that's funny. So I was gonna say, like, people think that it's like my dentist, the one I'm going to now, which is covered by my insurance, which I'm not too sure about her, but she doesn't believe, like I said something about, could we just wait and see on this cavity? Maybe it's going to heal itself. And she was just, it was like I was speaking in tongues, she was like, you need, is she going to call the psychiatric on me,
Yep.
And she was like, that's not a thing, she was just like, I don't know what you're saying, I was like, okay. And she was like, well, she's like, I'm not aggressive. And I'm like, I don't believe you. Because this is like so many things you've already said you wanted to fix on me. Um, so I don't know, but tell us, is that true? Can cavities heal themselves?
Yes. So as a dentist, we're trained. Well, first of all, the tooth has an enamel, which is like the outer cap, and then it has underneath that is dentin. So the enamel is 97% mineral, very hard. The dentin is 70%, so it has more organic material and it's less softer. So if a cavity is still in the enamel, the hard part, we're trained like you can watch that can remineralize, so you stop eating the foods that's causing the acid attack, you get your diet under control, your mouth is shut, your nasal breathing. Yeah, that can remineralize. That it's not even debated. like that's not a controversial statement. Now, if and when a cavity gets into the dentin, we are trained to be like, hey, we got to fix that cavity now. It's now into the soft part of the tooth where it can move much faster. And if it gets to the center of the tooth, which is known as the pulp, that's where the nerve and the blood supply is, well, then you need a root canal. So the reason, like, if it gets to the dentin, we treat it is because if we don't, and then it gets to the nerve, well, one, you need a root canal and a crown, likely. But also, then it's just malpractice because you should have treated it like to the standard of care if it got to the dentin. So that's kind of that's what we're looking at here. Now, when it comes to like, even if a cavity is in the dentin, you can still arrest that decay, meaning like it can still stop and you could need no filling. But most dentists are not going to risk that because it's a liability. Like you said, they're not going to also get paid. So it's like, I'm not going to risk liability and this is what I do. And it's clearly there in the x-ray. Like we can see the cavity. Almost any dentist you're going to go to is going to recommend a restoration at that point. But I do believe, and I think it's kind of borne out in evidence that even if it is in the dentin, it can also be arrested and you can remineralize that. These odontoblasts that are in the dentin they can create what's known as reparative dentin. And so basically it can heal itself. So that's kind of the long answer there.
If you have adequate vitamins
Nutrition,
and
yeah,
minerals and
if you stop the assault that the tooth has been under, yes, then it can repair itself, reparative dentin.
and do you believe that there's some evidence for the cod liver oil?
In the sense that it's high in these fat soluble vitamins, which are going to play a role in, like we talked about, calcium metabolism and kind of fortifying the teeth, both from the outside and the inside. So the tooth can really be thought of as like an organ because it has like an internal nerve supply, internal blood flow. And so it's being nourished both through the canal where nutrients will be used from inside out, but also from the outside in where you'll get remineralization of things like the enamel.
Um, I heard a lot of people like talking about like reflexology and things about how the teeth are connected to organs and stuff in Chinese medicine. Is that
Mhm.
true or
the various meridians and things like that. I honestly don't know much about it. Yeah, I mean, besides knowing what you're talking about, I
yeah.
don't know if there's any truth to it or or what.
And then like, some I think like Native Americans like believe you can't like it's bad to, I don't know, pull your teeth out or something.
Well,
Like
I'd agree you don't want to lose your teeth, but if it's bad for another reason, like it has some systemic connection through a meridian line, like of course the body functions as a whole unit, and I think people lose that like that thought. So like what is happening in your mouth can absolutely affect, you know, downstream health, and we have so many examples in dentistry where we have these oral bacteria that are then found in brain plaques, heart plaques, colon cancer. I was just posted on that recently how there is bacteria that's supposed to be basically isolated to the mouth that becomes prevalent in when you have gum disease. But they found that people with colon cancer have a high prevalence of this oral bacteria in the tumors.
wow.
So yeah, what's going on in the mouth is not just isolated to the mouth. The body acts as a unit, and especially like the connection between oral health, I should maybe say oral disease and systemic disease, there are a lot of strong connections there.
Yeah. Is there any truth to like, I mean, I've seen some people saying like there's big pus pockets where you get your, if you had your wisdom teeth out, like should you get those vacuumed out or
Well, you can absolutely get like abscessed and where the wisdom teeth were, but I think you're probably like if you've had your wisdom teeth out for years and years and you haven't had any issues and someone's saying you need to go get that cleaned out, I would be cautious.
okay.
But you absolutely can. Like teeth do abscess, like we talked about, um, the cavity going through the enamel to the dentin and it makes its way to the pulp chamber. Well, what's going to happen is that tooth is going to abscess where it's going to die and bacteria are going to make its way through the channel and it's going to start an infection in the bone. And that can, like, I'll see, like, for example, kids that this happens all the time. I'll see like a draining, you'll see like a bubble on their gums
Oh my
and
goodness.
it'll just be a draining abscess. And, so these bacterial infections absolutely happen in the mouth all the time. And
Wouldn't they be in pain?
uh, often, yes, but it's it's one of the interesting things is I'll see some mouths that are just wrecked and there's abscesses and I'll ask the kids any pain and they're like, no, it's fine. Or it used to hurt. And that's common. So like,
Uh,
so there was pain. The abscess found drainage through this bubble, which can relieve some of the pain, but it's still an active infection. And
hmm.
that tooth's got to come out.
So once you pull a tooth out, uh, is like the problem over with?
Well, the source of the infection is removed, so in a way, yes. But new problems can arise then because, um, I mean, there's a lot of various things that can happen. For example, like teeth, you remove a tooth, the tooth next to it will likely start to move because there's nothing then bracing it. So then you get changes in your occlusion, the way the teeth fit together, which is not necessarily the end of the world, but once you start getting changes in occlusion, then you can start getting recession around teeth. And if you have recession, then you're going to feel sensitivity. So it's kind of like this spiraling thing where, and a lot of people just don't want a missing tooth there either. So, uh,
Yeah, I think it
but
depends
yeah,
on what.
as far as the source of the infection being removed, yes, you get rid of that, but not usually you don't always want to just keep it there. Maybe if it's a back tooth, you're like, all right, don't need that one. But
Yeah.
some of these other front ones,
Yeah,
a lot
my
of times you
husband has
keep
a
those.
few that, because he grew up in a different country, so I guess it was more common to just pull them out and then, but he's got way better. It's weird. He's never gets cavities, and I'm like, what the heck? I got told I got all these problems and but can you turn it around? I mean, like I grew up eating standard American diet and everything and can or does it just take a certain amount of years to turn it around?
I think it could be turned around just basically overnight, meaning once you start getting the nutrition you need that fuels the tooth from the inside out, as well as the outside in, and you stop the acid attack, which is from fermentable carbohydrates. So you stop all the carbohydrates or limit those and you limit snacking. So a lot of this acid attack has as much to do with frequency as it does amount. So if you just ate 100 grams of carbohydrates, of fermentable carbohydrates right now, and you just guzzled it down, we'll call that one acid attack. But if you sip on that throughout the day, your teeth are bathing in a low pH environment throughout the day. So they're being attacked all day long.
So like drinking a
So
Coke all day or something.
exactly. So that's why I said, like, if you got to drink a soda, it's better just to get it done
Chug
with
it.
than to sip on it all day long, at least from your teeth perspective. But yeah, if you stop doing that, then the body can heal itself. It can stop the acid attack and really start turning things around overnight. There's certain kind of infections with periodontal disease that maybe you need some extra help to clean out that infection that's going on. But in general, if things are minor, like, yeah, it doesn't take years to turn this around. You can start turning it around right now, just changing your diet. And like I keep mentioning, breathing through your nose so the mouth is shut, because the saliva is basically, if you think about like washing your hands to keep them clean or something like that, like the saliva is what's keeping your teeth clean and nourished throughout the day and the night. So mouth breathing will increase your risk of all oral health problems basically by a significant amount.
So do you tape your mouth at night or?
No, I just breathe through my nose and mouth shut, which should be the default mechanism. But like myself, and I know many other people, kind of have to train this, and it's really through proper oral posture, and practicing proper oral posture, which is your lips are sealed, the tongue is rest on the palate, and it should create a suction. So if you swallow, you should feel like your tongue push up against the palate, and it should create like almost a suction mechanism where it doesn't feel like you have to force your tongue up there all the time. And with practice, you get a grip of this proper oral posture and it becomes natural, and that's the way you want to breathe. And so that's the goal, is so you don't have to consciously think about breathing all the time, because that would be exhausting. But with
Yeah,
some practice and awareness, you definitely can train it, and mouth tape can be a real nice training aid to get you there.
but you can't do that to a 3-year-old.
Well, you'd be surprised. I mean, there's various things you can do it, like, and various kinds of mouth tapes that can help. And I think while they're awake, um, is like that'll translate to sleep. If you see a 3-year-old sitting with their mouth hanging open, like helping them, hey, let's close the lips, close the jaw, like training that while they're awake will eventually translate at night.
Now, does brushing and flossing really make a difference, or only if you are eating like a really sugary diet? Or like, because sometimes I think, well, if I only ate meat, then do I really need to brush my teeth?
I think it's a great question. And so I like to take, it's going to be an unpopular opinion, but so I am obsessed kind of like with the archaeologic record. And maybe I can cover this very quickly, but it's a lot of history. If we look at human fossils, teeth, prior to the agricultural revolution, which was roughly 10,000 years ago, they had very low rates of cavities, malocclusion. The oral health was by all means great compared to us today. And they weren't fluoridating their water. They weren't brushing their teeth with special toothbrushes and toothpaste and mouthwashes, and they weren't doing any of this stuff. Assuming, 15, 20, 50, 100,000 years ago. But with the agricultural revolution, we see a dramatic rise in cavities, and that's when
Like,
we started eating crops. So what was a hunter-gatherer diet, which was lower carbohydrate, high in nutrition, turned into an agricultural crop-based diet, high in carbohydrates that are fermented into acids and create cavities in the teeth. So we see that in the fossil record. So I would say it only makes sense if you're eating like a species appropriate diet that your teeth aren't decaying and rotting out. Now, I'm not saying don't go brush your teeth or anything like that, but I don't think it should be necessary to maintain oral health. In fact, I would say if it is necessary to brush your teeth and floss your teeth and use these mouthwashes to prevent cavities, your diet is probably off. Like you're probably eating an incongruent diet with what we're designed to eat. Because teeth have gone through very strong selective forces, evolutionary wise, because they play a very important role in um, survival, eating, which is perhaps like the strongest kind of selective force, on an animal or an organism, is like being able to get energy. So the long story is that I was trying to make short is we could see in the fossil record healthy teeth, far less cavities than we have today, without the technology that we use today to try and maintain oral health. That said, like you mentioned, so in eating a standard American diet that is high in carbohydrates, high in sugar, they're snacking all the time. It is basically imperative to be brushing twice a week,
Oh yeah.
flossing, like doing these standard recommendations to help prevent decay. But even then, it's not enough. Like cavities are still the most common disease in the world. So like even if you're eating a bad diet, like we still see 50% of US adults nearly are have periodontal disease. Like it's crazy. So I would say those things are imperative if you're eating a bad diet. But if you're eating a good diet, I wouldn't say they're imperative. Though I do think, brushing your teeth, I recommend not fluoride, like hydroxyapatite is a nice preventative measure. It's kind of like going to the gym. I think it's like, do you need to go to the gym to be healthy? Probably not, but I think it's good, especially if diet isn't always perfect. To lift some weights. So
Well, it feels good to brush your teeth. I mean, just like feels, fresh or
yeah,
like you took a shower, it's
right.
like it feels nice,
Yep.
um, even if now what's the deal with uh like implants? People talk about like EMFs and metal and I don't know all this stuff, but I have one here. No. Oh, here. Yeah. Because I had a
Hmm.
baby tooth and it was
Yep.
like there as an adult. And then all of
Hmm.
a sudden it just fell out and
Yep.
it was like in the front. So I was
Yep.
like, oh my God, I have to do something.
Yep.
And no, so now is this like a lightning rod or what?
It's a very good question because a lot of times there's a strong group of people that are very anti root canals, which I get both arguments, by the way. But regarding those that are against root canals, I'm like, well, then you have to take the tooth out. You can't just leave an infection in there. No one's
Hmm.
doing that. That's the worst idea of anything. So
Yeah.
then your option is what? Often it's a implant, or you can do a bridge or something or a partial things like that. But let's just talk about implants since that's what you're brought up. Well, then, like you said, you're putting a piece of metal into the gums, right? So there's concerns with that as well. There are biologic dentists who will put ceramic up there, which is, I would say, it's not a it's not a metal, so it's not it's not going to conduct like you're saying. I think some of the fears around implants and having metals in the mouth are maybe slightly overblown, depending on because some people act like it's the end of the world and all your health problems are related to a filling or an implant. I think that is possible. I don't want to say it's like, hey, that's not true, but I think for most people, that's not the limitation. Like if they're having health issues, it's probably not because they have an implant. It's probably
Yeah.
because of their diet or something else.
Yeah.
Uh, so
Also, wouldn't you have some signs like the gum would recede or soreness or redness or
yeah, so implants will, I'll say notoriously, or they'll fail. They'll fail to osseointegrate, and you'll have pain, and it'll become wiggly, and they'll take it out. If it really integrates, like I said, I don't think it's free of potential issues. Like it's ideal not to have metal in your mouth, um, but I don't think it's for most people is the like. If I were you, I wouldn't go get that taken out and do something else. I mean, if you're not
well,
having any
it
problems with
costs
it,
a
you
fortune. I
needed
mean,
something.
I'm
Yeah,
not, I mean, I've had it like 10 years and the gum looks pretty good. I mean, it's not perfect, but it looks pretty healthy.
right.
And
I mean, like if you lost an arm, you would like a prosthetic arm. It might
uh
it's not as good as your real arm, probably, but it might be a piece of metal that's conducting. But so I think it's just important to put this in perspective because I think sometimes it gets blown out of proportion both ways. Some people would say no risk at all, get all the implants you want, and other people saying get those taken out. You have an antenna in your mouth, and that's not
yeah.
what you want. So I'm somewhere in the middle.
Well, I mean, that's what I feel about like most things because there's
Yeah.
some even like politics, or it's like somewhere in the middle is probably the truth.
Yep.
Um, because some people are so radical, freaking out about every tower or
Yep.
um and also it is a financial issue. I mean, I had that 10 years ago. It was covered by my insurance at the time. If I got that out now, it would be a
Oh
big
yeah.
problem, it'd be a big expense. And if it's not causing me and I pretty much feel pretty good
Oh,
most of
and
the
the
time.
health risk associated with getting it out would probably be greater than the health risk you have with it in. Uh, yeah, because it wouldn't be easy to get that out.
And a whole lot of visits, and you have to wait and because it was a big process to get it in the first place.
Yeah, and then you got to think about what's the alternative. So you're just gonna leave a gap there. You're gonna put something else there, and then that's something else you're gonna put in there. You're gonna be like, well, that also has risk. So it is. I kind of what we're talking about here is like almost the best thing is to keep your real teeth right and do everything right. But if you have to have some kind of intervention, there's pros and cons to everything. So it really is weighing what are the pros and the cons.
And I can just be all natural, I'll fit right in down here in the South, right? Have a tooth coming out. Well, I'm sure we could talk about this stuff all day. I love talking about this stuff because I've had a lot of issues myself, but also I feel like the diet, following the carnivore diet, I started in 2018. And I do think if I did eat a standard American diet, my teeth, whatever you say about genetics, my family, a lot of people have a lot of cavities, or, your grandparents might have had, both my grandfathers had dentures, which
Mhm.
means that means something, So I'm sure that whatever I'm doing is slowing down whatever would
I
be.
am confident it is. Like, yes, the diet is the primary role for teeth being healthy or not. And the fact that you're not eating the macronutrient that is converted into acids that causes most of the problems in the mouth, like obviously your risk is now mitigated to it's basically as low as it goes.
Well, that's good. I mean, because, going to the dentist sucks. And so tell us where we can find your work, Dr. Stock. You have a lot of free guides and stuff, right?
Yeah, for carnivore stuff, meat.health is a website with, like you said, there's a bunch of free guides about how to start, a 30-day guide to how I would recommend starting a carnivore diet. There's a guide on why I started removing plants from my diet and, why it's called Health Dangers of a Plant-Based Diet, but like why plants aren't the health foods that just everyone assumes they are and eat as much as you can, as much as you want. And there's also a loss guide there, which kind of combines some of the ideas from, my previous life, like focused on fitness plus like a meat-based diet and how can these two work together to get people to their fitness goals. So yeah, there's free guides there, and I'm on social media and I write a weekly newsletter, so people can find me however they like,
Yeah,
whatever kind of like to
your guide
consume.
was one of the first ones I downloaded when my sister told me to try the carnivore diet. She did it first for like a month, and then she lost like 20 pounds, and I was like, I want to do it too.
Hmm.
And then that was, 5 years ago or something. So,
Yep.
well, thank you, Dr. Stock, for taking the time. I know you're busy and we really appreciate it. Please follow Dr. Stock. Is what's your meat.health on Instagram?
Meat.health is the website, Instagram, and all over. I'm just Kevin Stock 12 is usually the handle, Kevin Stock 12.
Okay, great. He puts out videos every day. Sometimes I re-share them because they're mostly exactly what I would think. So thank you
Thank
so
you.
much. It's really great to meet you, and make sure and follow Dr. Stock and leave
Thank
a
you,
thumbs
Kaylin.
up. Share this video with a friend who might help, who's getting lots of cavities. And we'll see you next time. Bye
Thanks,
bye.
Kaylin.